Pula Vinaka, and a warm welcome to Speak Your Mind on Gold FM. I'm Louise Kaunisela. The leading cause of death in the country and the world is cardiovascular diseases. The heart beats about 2.5 billion times over the average lifetime, pushing millions of gallons of blood to every part of the body. When the heart stops, essential functions fail, some almost instantly. Given the heart's never-ending workload, it's a wonder it performs so well for so long for so many people. Now, as we know, the leading cause of death in the country is cardiovascular diseases. Now, our guest in the studio today is from the Oceania Hospital, and he is cardiologist and specialist physician, Dr. Omar Niazi. Welcome to Speak Your Mind.
Thank you very much, Louise. So, you are 100% right that in Fiji and particularly in other part of the world as well, the leading cause of death is cardiovascular diseases.
Right.
And what does this mean? Cardio means heart and vascular means blood vessel.
I see.
So the heart has three major parts. Like one is a heart muscle.
Mm-hmm.
Second is the blood vessel, which supplies oxygen and nutrition to the heart muscle. And third part is its conduction system, impulse system, which helps the heart to contract and relax. So it has three major parts.
Right, main parts.
Main parts. And the diseases of three major parts are different.
Okay.
But today we'll discuss these blood vessels,
Mm-hmm.
which are called the coronary arteries of the heart,
Mm-hmm.
and arteries of the brain, which cause stroke. And arteries of the heart, when they get blocked, they cause heart attack. We'll discuss on this today.
Okay, so that will be my question. So how do heart attacks and strokes occur? Are they related to one another?
Well, you know, our cardiovascular system is like a long tube, tight system. So blood vessels are the same. The anatomy, physiology is the same.
Okay.
Wherever they are, with variation to their size and their distance.
Mm-hmm.
And the blood vessels of the brain are the same, but when they get blocked due to thrombus or narrowing, so person gets stroke. Or when these blood vessels, they get ruptured because of high blood pressure, then we call it that hemorrhagic stroke. So thrombotic stroke and hemorrhagic stroke. And it depends which part of the artery is involved. If the smaller artery, small stroke. If the bigger artery, massive stroke. So, and then its results depends on this, like how much severe or mild the stroke was. And this one, like coronary arteries, the heart arteries, they supply oxygen and nutrition to the heart muscle.
Mm-hmm. Which is one part of the heart muscle.
Yes.
Yeah, the three main
and
ones.
It's
right.
working. It never stops.
Never stops.
It needs oxygen and nutrition every moment. Okay. And these blood vessels, when they get narrow due to different risk factors, so are they get blocked due to clot formation, or the plaques, the cholesterol gets deposit, like LDL cholesterol, when it get deposit into the middle layer of the coronary artery, so it makes a plaque, and it moves toward the lumen of the coronary artery.
I see.
And when there is any inflammatory process or any stimulus which causes the rupture of the plaque, then there is a big clot there, and it blocks the whole artery. 100% it's blocked. So the following segment of the heart, like we say, there are 16 segments of that heart muscle, and that following segment that become dead. That's why we call it myocardial infarction. Myocardial mean heart, infarction mean death. So depending on that, this is like such an emergency that when it 100% block, within 1 hour, that segment is dead. If you can do anything during that time, you can save.
So
if
maybe
not,
CPR?
Well, CPR is a process when patient is dying with the arrhythmia and almost heart has stopped, is not working.
Okay.
That is the process to revive it and then gain time to give other
Yes.
medications.
Right.
That is a process
Yeah.
when the patient is cardiogenic shock.
Mm.
And you do your best, do all the protocol to help that person to come out of that massive heart attack.
Because you said only 1 hour if
Yeah,
they have that really bad heart attack.
1 hour is cut-off line. So if it is 100% blocked, and then muscle is going to die.
Oh.
But if it is like partially blocked,
Mm.
or the minor part of the artery, if the artery is a major, blocked from the beginning, supplying a lot of heart segments, if that is blocked, then it is massive. It is massive. But if the blockage is distal part, remote area, 1 or 2 segments are involved, so you get time. You get time. It's not massive. It is minor. So still, heart attack is heart attack. One, it is there. So it causes the death of that, necrosis of that segment, death of that segment, and it affects the whole life because that segment is not working. In your initial introduction, you already mentioned that million of gallons this heart pumps.
Yeah.
This is the reality. So when 16 segments together, they have to pump. And then when you are left with 2, 3, 4 segment or 10, 8, 5 segment. So depends that how much that segment can support you in the rest of your life. So you have to be careful for this, that it should not be the first event. So our purpose here, the public orientation is how to prevent this like first event, that people should not get first stroke, they should not get first heart attack.
Okay.
So this we will try, I'll try my best to like that to the listener.
Yes.
So they should, that after knowing the fact, how they can like become proactive to prevent the first heart attack, to know their risk factors.
That's wonderful. Thank you, Doctor. So what, well, actually, we'll have to come back for that question on Speak Your Mind, Gold FM, only the classic hits. Welcome back to Speak Your Mind on Gold FM, only the classic hits. And now we shall go on to our second question, Dr. Omar. What are the signs and symptoms of heart diseases? How will a person know that he or she is having heart problems?
Very good question. We particularly discuss this heart attack because heart diseases are a lot. And sign symptom, the symptom is like a lot of people, they really want to know. So what they should know about what is happening to them, and then they should come to the doctor. And what are the symptoms? So we say normally that below the tip of the nose, above the umbilicus, any pain is called the chest pain. So in this area, so pain is first thing to exclude is cardiac pain because it's an emergency. Other causes, few other causes are also emergency, but they give you some time. But this, as I mentioned, you don't have time if it is cardiac. And the symptoms are that if someone is having cardiac pain, so when they walk, they will feel chest tightness, discomfort, burning sensation, or short of breath. And when they stop, the symptoms are relieved. They get better. Again, they walk. So this severity tells us how much severe is underlying coronary artery disease. If somebody only walks like 50 meter, and then he has to stop, so it's like limiting him to do any exercise. We call it New York Health, like NYHA classification, like 1, 2, 3. So if someone is mild, moderate, severe, and that classification is the symptoms are very severe, that shows that this person is going to have heart attack very in near future. So these are the signs and symptoms. So people experience before heart attack.
So if it's a severe one, is that the one that you just explained when you walk for only 50 meters and you're struggling to get your breath? That's a sign of quite a severe heart attack. And for a mild one?
Mild one that, well, as we know, when this process is gradually developing. So if it is all of a sudden, like in some male people in 30s and 40s, all of a sudden blood clots comes and that plaques ruptures, totally blocks, it is out of nowhere. All of a sudden you get this heart attack. But if it is like stable angina, angina means that heart artery gradually getting narrow, and then these symptoms are developing gradually. That only you walk like more than 100 meter, 200 meter, then you feel some tightness, and then if you still keep on doing the job, you feel some shortness of breath, still you keep on doing the job. So, and then with rest you feel relieving symptoms. So it means that is minor. And underlying coronary artery blockage maybe 40%, 50%, 60%, 70%. So depending on the blockage, your symptoms are accordingly.
Okay. Yes, thank you very much, Dr. Omar. So what are the risk factors for heart attacks?
Well, as everybody knows, like cholesterol is a risk factor, and the aging process is a risk factor, because with growing age, our body vital organs, they become weak, right? And blood vessel becomes stiff. So growing age and male, particularly for heart, and then diabetes, cholesterol,
high blood
pressure, smoking. So these are the risk factors for the development of the coronary artery disease. And these also contribute towards the blockage of the artery of the brain. They can lead to the stroke and high blood pressure. When it is not like rupture of the artery causes the hemorrhagic stroke.
So there's a lot of factors involved in actually, in getting a heart attack, like you said, high blood pressure, diabetes.
Yes, that also, also
there's
contributes.
So many.
And like pressure, people don't know when to start the medicine for the pressure. So the safer range is like 120/70.
That's normal.
So safer range.
Safer range,
so
right.
We say mild blood pressure, moderate blood pressure, severe blood pressure, and blood pressure emergencies and blood pressure urgencies. So different like categories of your blood pressure.
Right.
And blood pressure in the children, blood pressure, the pregnant woman, blood pressure in the old. So different people have different sort of blood pressure. But if young people with this essential hypertension, so that it means they are not having other cause because of this age and factors, they are high blood pressure. For those people, so they should start medication along with other measures like diet, regular exercise, and reducing like their weight. And then they should keep their blood pressure less than 140/90. If the pressure is more than 140/90 and you have a risk factor for the coronary artery disease, you should control your blood pressure. You should start your medication.
So it's important to always know the status of your blood pressure. I mean, it wouldn't be nice to even have one at home, monitor your own high blood pressure maybe. Oh, I mean, your pressure, not your high blood pressure, but yeah. I mean, it's so important.
Yeah, like cholesterol. So if the cholesterol level is high, like cholesterol, we say acquired reason are the familial or genetic causes. So some people have familial hyperlipidemia. So it was high in their parents. From there, they got it. And still the people are having very high cholesterol. So that is one reason of high cholesterol. Another is that people acquired, like you eat very rich food, high fatty food, and your diet is one of the factors that you have very high cholesterol. So along with other factors. So that cholesterol level, if it is more than like 5.4 and you have other risk factors, you are prone to develop coronary artery disease.
Oh dear. But then the thing is, if you do find that person has high cholesterol, but you can always control it. like put down the cholesterol. But what are you supposed to do to put that cholesterol down?
So, like the diet and regular exercise is the first thing.
Okay.
And if you don't have other risk factors, so then we see the age of the person, whether this is a male or the female, or what is the other risk factor along with that. Is somebody smoking or the diabetes? So I treat the cholesterol differently
Okay.
because every individual is different,
Okay.
and their health status in a overall scenario is different. Then we see that one, that okay, we should start medication or we should continue with this exercise and diet and to control this one. So we make the decision depending on that person's clinical history, examination, and the status.
Thank you, Dr. Omar, on Speak Your Mind. You're on Gold FM, only the classic hits, your only classic hit station in Fiji. Speak Your Mind on Gold FM, only the classic hits. I hope you're enjoying the program. Thank you a lot for your company. Now, if you have a question, you can call 3220906 or you can call 77-32906. So my next question, Dr. Omar, is there any criteria to assess the percentage of risk in an individual?
Yes, madam. Well, we have WHO guidelines that that can help us to assess if someone is having 10%, 20%, 30% or more risk factor to develop cardiovascular diseases during the next 5 to 10 years. For example, the age, and then cholesterol level, systolic blood pressure, if person is diabetic or smoker, male or female. So that table, that gives us a very clear cut, very easy to assess.
Okay.
So we check how much is the systolic blood pressure, and we see the bar. What is the level of cholesterol? Is it 5, it is 6, it is 7, it is 8? Then how much is the age? So from that graph, when we see that bar, we see in this block is 10%. This person fall into 20%. This one fall into 30%. So this is how we can assess that someone has like 10, 20, 30% risk factor to have coronary artery disease or cardiovascular problem during next 5 to 10 years. So when any patient comes to us or any person comes to us for screening, so this is what we take: the history, we examine, we analyze the blood test, and then we have very clear-cut idea the possibility.
Sorry, doctor. When you do the blood test, what are you essentially looking for? Like the main things for, showing what your patient has to look into the future. Is it cholesterol, one of the main ones?
But particularly it depends that who has come to us, age factor, and whatever their complaints, what exactly, because we want to remain very specific to the investigation.
Okay.
It's not that we'll do 100 of investigation, we said like, okay, these are necessary. No. If specifically someone is coming for this heart issues and they tell, well, they have cholesterol, already somebody told them, or the pressure is high, or these are the symptoms, or they're feeling discomfort and the pain and all that. So then we go for the routine tests are, we do the full blood count, kidney function test. Sometimes people are having kidney problem, but they don't know. Most of the time people are anemic, they don't know.
True.
That can also give them this all symptom what we are talking about.
Right.
So and then liver function test, previous any history, because the liver is very important in metabolism of all these foods and nutrition and all these things. And then cholesterol metabolism is also relative to the liver activity and function. So previous any history of hepatitis and all that, if liver function is less, then even minor intake of cholesterol will be difficult for that cholesterol to metabolize it, to utilize it. So that's why
lot of factors.
So then we check the cholesterol level. In the cholesterol level, we check total cholesterol, triglyceride, low density lipoproteins, and high density lipoproteins. So different types of these cholesterol level, they individually give us the information so that this one is going to give what problem in future. Like LDL, if it is high with the total cholesterol, then we say, okay, well, this person has a more possibility to have this coronary artery disease because he has other risk factors as well. So then we decide, as you asked me before, and I said, well, we decide depending on the outcomes.
Okay.
So other tests, if needed, we do the ECG. If needed, we do if they need a treadmill test, we do the treadmill test. We do the echocardiography if somebody is having palpitation. So heartbeat is more. So we have that facility of doing the Holter monitor in our. Previously, it was called Mayo Pacific Hospital. Now its name has been changed to Oceana Hospital. Oceana Hospital.
Hospital, yes.
So we have all these facilities, and we do all these tests, but only related tests which are just patient come for these symptoms and all that. And the screening of the cardiac things, we have all these basic tests. And on the top of that, so in preventive cardiology, the revolution which is bringing the CT coronary angiogram, when we do that one, we can get 98% this information regarding the health of the coronary arteries and possibility in future that the person can have this cardiac event or not.
That's amazing, because you're actually telling the person that they have this much percent of having a heart attack. So it could be 10%, 20%, 30%, or even higher. Well, thank you very much for that, Doctor. Now, do all the risk factors that you've talked about cause heart attacks or stroke?
It's a very, very important question. Like, also for the people who really listening this time. So, knowing this, that if someone is having the risk factor and they are newly diagnosed with the high cholesterol, with the high blood pressure, with the high, or they are having diabetes. So people really got scared of that. And they think all that complications and things they have heard, the bad things they have heard about these things, so now they will be having in future. But they should understand these are causation. These are not causation, these are associations. Association means when studies were made that people who were having heart attack, so they found that people who had heart attack, they were having 1, 2, or 3. These risk factors were there with those people. That's why on that database, on that information, so it was concluded that these are the risk factor for the heart attack. But it's not like that if someone is having diabetes, 100% that they will get the heart attack. It's not like that. So people should not be afraid of that. If they manage their cholesterol, if they manage their diabetes, if they manage their pressure, if they stop smoking, they do regular exercise, reduce weight, reduce stress, and they have their balanced diet, so definitely they are not going to have it.
Right.
Because there are millionaire people with all these symptoms, but with all these conditions, but they are not having heart attack. But because these are associations, they are not causation.
Oh, well, that's great information. Thank you very much, Dr. Omar. And we'll be back soon on Speak Your Mind on Gold FM. Welcome back to Speak Your Mind on Gold FM, only the classic hits. It's really good to have as my guest in the studio today from the Oceania Hospital, cardiologist and specialist physician, Dr. Omar Niazi. And well, my next question for you now, doctor, is when, like when you have a patient and you tell that person, for instance, she or he has 10%, 20%, or 30% or more risk for developing these events to do with the heart. What does that mean? How should they manage these risks?
Well, as I am member of Internal Medicine Society of Australia and New Zealand, and for last 7-8 years, I'm attending those scientific conferences in Australia and New Zealand. So in one of our conference 3 years back in Tasmania, Dr. Warwick Bishop, so he presented, and he brought this revolutionary book, which is this one is like uh, have you planned your heart attack? Like, have you planned your heart attack? So after reading this, and then I got really guidelines that telling the people that no, after the clinical examination and the history and investigation, now we know that you have now 10, 20, 30% your risk factors. So people ask what next we can do. So we got that evidence base that we can recommend the people for other tests. Like if they are having this high cholesterol, we say, okay, you have to manage cholesterol with the diet or with the medication, right? And if they are having any symptom of coronary artery disease, we advise exercise stress test.
Okay.
So people have to walk on that machine. We connect these leads, and then they walk 3 minutes, 6 minutes, 9 minutes, and then at the same time we record their blood pressure, the heart rate, and then we check the symptoms. And their clinical examination, physically we see the peripheral hypoperfusion is there or not, what type of symptom is there. Collectively, when we see, then we can assess the possibility of heart disease is there or not. So if I suspect this person, although have done good test on treadmill, but the symptoms are there, then we recommend for the CT coronary angiogram. So we are blessed in Fiji for the last 2-3 years. We have that CT coronary angiogram as well. So it gives us 98% evidence about the health of the coronary arteries.
Wow.
We can see if there is any calcium load there or not. Is there any soft plaque? Is there a hard plaque? So is this person is going to have a heart attack very near future or in a remote time? So that all time we can adjust, we can see, we have evidence with that. So this is like preventive cardiology. We talk to the people, well, if you have all these things, with knowing this, getting these tests, if they are not contraindicated, some people with the severe kidney failure, we don't do this test because we give that dye and then that injection and that. So, but it is quite safe, rare side effect, but the information is life-saving. So we have all these facilities, and even coronary angiogram we do. And then we can deploy the stent if arteries are blocked. So
what is a stent?
Stent is like one material that when artery is blocked, you take through the guide wire and catheter, and then you just open the blocked artery. So when you put the balloon, the balloon dilates, and then it the ring, that stent that opens, it opens the artery and fix there. Wow. We deflate the balloon, we take this out, and then stent remains there. We open the arteries, block arteries. So before somebody gets heart attack, you have opportunity to find out if the blockage is 60, 70, 80%. You get this open. Don't wait for the heart attack or the even to take place. Then proactive. Do it.
Yes,
do
get
it.
all these tests done.
Yeah.
Which can easily be done by you.
But in the Mayotte Hospital, I can do it. Other people, they do it. CWM and the people are doing it. And Nandi Hospital, one private hospital, they are doing it. So stenting, they are doing it.
Yeah, so stenting is a simple procedure. How long does it take?
Well, it depends how many arteries and how many stents you have to place. Ooh. And what is the condition of that patient. So in 45 minutes, you can finish that test. And it is very safer as compared to bypass. Before, what used to happen, before this stenting, people have to go for the bypass. They cut the all chest and then stitch it again. True. And you are healing in process for 3 weeks, 4 weeks and all that. But here you are talking to us, and then with that from this arm or from the leg. So mostly we do this process from the arm. From the arm, so you just take the catheter, and then this is loaded with this stent. So you dilate it, you place it there, and you are awake.
Amazing.
You are seeing what's happening. And after that stent, you can walk down to the to the room. So this is how
Amazing.
and one thing I tell you, that if I can take the benefit of this as a doctor, when I had mild chest discomfort, immediately I got this test done because age and the family history was there. I had one blockage, and then I got angiogram, I one arterial block, and I got the stent done. So I did not wait for the heart attack to come. Although aging process and death is true for everybody,
yes.
inevitable. But if I can take advantage of this, then all the other people then take the advantage of early diagnosis and then investigation, and if something is there, get it fixed.
Sure thing. I mean, if you didn't get it done, you wouldn't
Yeah.
have known.
Yeah.
So when should a person get these tests? When even like you said, just a mild symptom of
Yeah.
what you've talked about,
Yeah.
it's the best thing to get the test
Yeah.
done. I mean, you'll feel relieved too when you get it done, and then you can find out the status of the health of your heart. Well, that's really interesting, Doctor. Thank you very much for sharing that with us. And yeah, that's the best approach, of course, being proactive, and that's exactly what you did. Now, when people come for screenings and find out that they do have an underlying problem with their heart, how do they respond to you?
It's a very, very difficult question, and it's a very important question. Well, human response, that every individual is unique. Their intelligent quotient is different, their emotional quotient is different, their social quotient is different, their knowledge is different, and their background is different, their faith and the beliefs. So all these things are different. So it's very difficult to convince someone to do something. A lot of people, even if they know they have this risk factor, but they go into a state of denial. They don't accept it. Like someone is a smoker. You tell them that it's really going to give you harm because you have risk factor and you are doing this thing. Possibility to get very adverse things is very high, but people don't listen because as you mentioned, that all these things, individual things, are very important. State of denial, people in state of denial, and like before we used to say that people commit suicide. Now this word has been changed into deliberate self-harm. So knowing the fact that cigarette is really causing damage to their body, and they do it, so it's deliberate self-harm, they are doing it.
Yes, but doctor, of course, then it's addictive as well, which makes it harder for the smoker to give up. But if it concerns your life, doctor, hey, but we'll be back on that subject again soon on Speak Your Mind. Hope you're enjoying the program. Do stay with us if you can. This is Speak Your Mind on Gold FM, only the classic hits. If you have a question for Dr. Omar, now's the time, 3220906. If it's a digital phone that you have, 7732906. Now, my guest is, again, from the Oceania Hospital, cardiologist and a specialist physician, Dr. Omar Niazi. So now, what is the message for the people, Dr. Omar?
Well, as already we discussed that age is one of the factor for a lot of other diseases, and along with that is cardiovascular diseases as well. And the aging process is for everybody. Like, you cannot deny this. Whether you are a doctor, you are a scientist, you are a prime minister, you are an engineer, you are a millionaire. So aging process is true. With age, these things will definitely come. And God has created us after His own image. He knows about us. He knows everything, that how will be our child age and middle age and old age. And in old age, when these things are there, aging disease will come. So if eyesight is weak, if the body is weak, if due to obesity we are having some issues, or hearing problem and the teeth. So these things will definitely come. And we should not lose hope. We should not lose hope. In this age, we need to be more spiritually strong, psychologically strong, and we should listen to the word of God. And all religion, they give us the hope.
Yes.
That to have high quality of life. Like in Second Corinthians chapter 4, is a verse, let me see this one, 4 to 16. For this reason, we never become discouraged. Even though our physical being is gradually decaying, yet our spiritual being is renewed day after day. So, diagnosis is there. The physical being is gradually decaying. Is diagnosis there? And the prescription is also in the book. That we see that Ezekiel 47 verse 12, that trees will give food and leaves will be used for healing.
See, that's a
Revelation
good
22:2 is the similar, that leaves will be used for healing nations. So when diagnosis is natural, this healing and the prescription is there. So all these medicine, either they are the plant source, the animal source, or they are synthetics. So when we eat, all this is like medicine. So we should not be afraid of this medicine. A lot of people get afraid of this medicine because of lot of conflicts. They don't take care of their sickness, and they want to treat it different way. They don't take the advantage of this medicine. So if you are diagnosed with some disease, you take the medicine, pray on that medicine will be converted into healing medicine.
Yes.
So that's I'll say particularly that a lot of people they lose hope, and they are afraid of medicine. Like some people, they say, oh, if I take this medicine for diabetes, it has side effect. So they are afraid of side effect. And I give them the example, like if people eat fish, like in Lambasa, in that side, Damu fish. So when that becomes poisonous, people eat fish, and we have the evidence that people die with fish poisoning. So it does not mean that if people die with fish poisoning, nobody in the world should eat fish. And the second example I tell them, if more than 200 people, they die on the road in road accident, it does not mean nobody should go on the road, nobody should drive. They should sit at home, because on the road they will die.
Yes,
Don't
yes, I get your point.
don't impose all these negative things upon you. So if when you are advised to do like regular exercise, reduce weight, reduce stress, take balanced diet, and if medicine is recommended, take that medicine. Don't think that this is going to harm you, like I gave you 2 examples.
Yes.
So you are not one of the millions or thousands or hundreds who get side effect. If there is any side effect, there is another alternative. But pray on that, get it healed. This is your life, to have high quality of your life. This is the promise of God for you, and then you should take the advantage of everything which is available in your life.
Thank you so much for that, Dr. Omar, for sharing with us in looking after ourselves. I mean, my grandfather used to tell me all the time, look after yourself, because no one else is going to. So we'll have to end it there. But it's been a pleasure talking to you, my guest from the Oceania Hospital, cardiologist and specialist physician, Dr. Omar Niazi. Thank you for coming to Speak Your Mind.
Thank you very much.
Until next time, I hope you've enjoyed the program. I'm Louise Kaunisela. Bye for now.